We're very excited to welcome Dr. Neil Vora, who's a physician and a pandemic prevention fellow with Conservation International. Throughout his career, he's focused on the link between human health and the health of the planet, particularly as it relates to an increasing threat of spillover viruses. So those are viruses that jump from animals to humans, specifically in this case because of the destruction of nature. His work has taken him all over the world, responding to and investigating disease outbreaks. And most recently, he developed and led New York City's COVID-19 contact tracing program in New York City, where he is still actively a clinical consultant physician. So we're really excited to hear from him. Pandemic prevention, of course, tied into a lot of the work that both globally and within the One Health Initiative. We'd love to invite you also to come back and talk to also our pandemic prevention institute that we've got from NSF. Yay, everyone. Dr. Vora, take it away.
Wow, thank you so much. I'm so glad to be here. I actually used to live in Tennessee for a short period of time. I grew up in Saudi Arabia, and during the Gulf War back in the early 90s, my family and I evacuated to Tennessee, where my uncle was living at the time. And so I spent a little time in Tennessee, and it's so good to be here. I'm going to share my screen with my slides. Alyssa, can you give me a thumbs up if you see the slides? All right, great. Thank you. And let me expand that. Excellent. All right. So I'm going to be focusing on prevention of viral spillovers as a means of preventing pandemics. But more broadly, this talk is about how saving nature is saving ourselves. And just a disclaimer, the views that I'm presenting in this presentation are mine, not necessarily that of my employer. I have no conflicts of interest. 4 different objectives here. So number 1 is to describe how human health is inextricably linked to the health of animals and the environment, which is fundamental to One Health. I think you all are well aware. Describe how current human activities are driving infectious disease emergence. Describe how the destruction of nature leads to health inequity. And describe actions health professionals can take to help address environmental destruction. And when I say health professionals, I mean broadly, everything from clinical providers all the way to researchers and beyond. And so there's a few definitions that I want to propose, because I think if you go through a variety of different sources, you will find different definitions. I'm going to use the ones listed here, but again, I understand that there are better ones out there perhaps in some instances, or there's different definitions depending on the circumstances. I use a pathogen to describe an organism that causes disease. A zoonosis is a disease caused by a human pathogen with a non-human animal source. Emerging infectious diseases are infectious diseases whose incidence in humans has increased or threatens to increase in the near future. And pathogen spillover is transmission of pathogens between animals and people. So this is a paper that I came across in 2008, and it changed the course of my career. I was taking a year off in med school between my 3rd and 4th year. I was doing a research year. I spent most of that year in Uganda. I was doing HIV and malaria research. And one day, out of the blue, while I was in Uganda, my undergraduate research mentor, who is a marine biologist — I did a lot of marine biology research in undergrad — emailed me out of the blue. And she shared this paper with me on global trends in emerging infectious diseases. And up until that point in my medical school career, I came into medical school with the belief that somehow human health must be related to the health of the environment. I didn't know exactly how. And I talked to a large number of faculty in my medical school, and a lot of them as well couldn't really help me see those linkages between human health and animal health and environmental health. And so I had somewhat of an existential crisis during medical school, because I was very interested in jointly advocating for conservation and human health simultaneously, but I didn't see a path forward until I read this paper. And this paper, again, looked at trends in emerging infectious diseases. And this is one of the figures from the paper. The x-axis shows the decade. The y-axis shows the number of emerging infectious disease events. And the bottom line is that the paper showed that emerging infectious diseases are increasingly occurring, and that most of these emerging infectious diseases are zoonotic. And of zoonotic diseases, most of them originate from wildlife. And for me, that was the light bulb moment. I finally had the epiphany. I could see how what we are doing to nature is increasing our risk for outbreaks, epidemics, and pandemics. And that set me on my course in my own career to finish medical school, go to residency, and then join the Centers for Disease Control and Prevention, the CDC, to do outbreak response around the world. And I had exactly that privilege. I responded to zoonotic viruses in Africa, Asia, and I just had the most gratifying experience through the course of that work, where I had a chance to save lives and do important science. But I also came to increasingly realize through the course of these experiences that zoonotic diseases are not esoteric events or not academic of interest, right? These are often diseases that can be extremely high consequence. Everything from rabies and anthrax to SARS back in 2003 to Mpox, Ebola, Zika, HIV, novel influenza. These are all zoonotic, and COVID as well is probably a zoonotic disease. COVID probably originated in a wildlife market, and the virus that causes COVID jumped from animals into people through the course of that wildlife market and those related activities. So these are high consequence events. And COVID itself is not a once in a century event. You know, back in 2020, 2021, a lot of people would state that, you know, this pandemic is a once in a century event. And I still hear that to this day. But the reality is that there have actually been 6 pandemics in the past 105 years. 4 of them have been flu pandemics. There's been an HIV pandemic, and then also COVID. And in total, these have killed over 90 million people. All of these pandemics, if you include COVID, all of these pandemics had animal origins. And given ongoing pressures, which we're going to be talking about, the frequency of pandemics is expected to increase several-fold in the coming decades. Now, what are the major drivers of spillover? Right now, there's a variety of different drivers, and I'm focusing on 4 major ones here, but there are others, and there's also a lot of different ways to cut up these different buckets. But land use change, particularly number 1 is land use change, particularly in the form of deforestation and forest degradation. Number 2 is the commercial wildlife trade pipeline. And I'm talking about both the legal and illegal wildlife trade pipeline, particularly wildlife trade pipeline in urban settings, not as much for uses by indigenous and local peoples and local communities. Number 3 is poor biosecurity when raising farmed animals, and number 4 is climate change. So let's do a deep dive into the first of these, just to explain how deforestation can actually lead to spillovers. And there's at least 4 different ways that deforestation drives infectious disease emergence. Number 1 is that it brings humans to the forest edge, increasing opportunities for human and domestic animals to come into contact with wildlife. Number 2 is that it stresses wildlife. Just like people, when we lose our homes or we're undergoing stressful situations, we might experience a greater likelihood of illness. The same thing goes with wildlife. They're losing their homes through the process of deforestation, and in the process, they increase their risk of getting infected and then subsequently shedding pathogens. Reason number 3 is that deforestation leads to the loss of biodiversity, and research shows that the species that are left behind tend to be generalist species that can continue to live alongside people despite having lost their native forest habitat, whereas specialist species, ones that are uniquely evolved to live in a forest habitat, are more likely to disappear. But the research also shows that these generalist species are also more likely to carry pathogens that can then go on to infect people. And reason number 4 is deforestation worsens climate change. And so deforestation itself is an independent, direct driver of infectious disease emergence, but it also indirectly causes infectious disease emergence because it leads to climate change, and climate change itself drives infectious disease emergence through a variety of different pathways as well. So the bottom line here is that human activities are driving the accelerating pace of pathogen spillover. Now, there's very little good that came out of the COVID pandemic. Tragically, millions of people have died, and there's all types of additional consequences of the pandemic. But at the very least, at least we now have a new global movement to reduce morbidity and mortality from future pandemics. And the recent Mpox situation just underscores the ongoing threat. So now there are efforts at the highest levels of government around the world to correct the failures of past approaches to pandemics. This is something that experts, including I'm sure many of you, have been calling for decades, that we need more investments in pandemic prevention, preparedness, and response. Unfortunately, again, there are now those calls at the highest levels of government. So if we want to do a better job addressing pandemics going forward, we have to invest in pandemic prevention and pandemic preparedness. Prevention is about avoiding a pandemic altogether, which is reducing the threat. Preparedness is about increasing the ability to respond if a pandemic occurs. So that's about reducing our vulnerability. Underinvestment in either one of these domains will result in the failure to lower the risk of another pandemic occurring or result in mismanagement of the next pandemic when it occurs. But unfortunately, even now, despite what we've been through recently with COVID and Mpox, even now in discussions about addressing the future risk of pandemics, prevention is often neglected in favor of preparedness. And what do I mean by this? Well, here, take this example. This is a snapshot from the independent panel, which was stood up by the World Health Organization, I think in around 2020. You'll notice that in the name of this independent panel for pandemic preparedness and response, prevention is not even mentioned. And they released their initial report in May of 2021. They called it COVID-19, Make It the Last Pandemic. And this report, in its 86 pages, only had one mention of the word deforestation and 2 mentions of the word wildlife. And it begs the question, how can we make COVID-19 the last pandemic if establishment global health voices are not even talking about the drivers of spillover? And here's another example. So in September of 2021, the Biden administration released a plan on American pandemic preparedness, transforming our capabilities. Page 7 acknowledges that new infectious diseases have been emerging at a quickening pace due to increased zoonotic transmission from animals driven by population growth, climate change, habitat loss, and human behavior. Yet, paradoxically, in the rest of this report, there are no goals to address spillover, even though they have goals about preventing laboratory accidents. Now, don't get me wrong. It is absolutely important. We do need to be investing in improving laboratory safety. But that being said, if you just look at the past 105 years, we've had 6 pandemics. 5, certainly, of those 6 pandemics were the result of spillovers of pathogens from animals to people. And almost certainly all 6 of those pandemics were, yet we don't talk enough about preventing spillovers in the first place. So why does the public health sector tend to neglect pandemic prevention? Well, I have a few hypotheses for this. And I think that number one is that traditional academic disciplines tend to constrain thinking around complex issues, including infectious disease emergence. And that's why I'm so glad that we are having the rise in the understanding of One Health and planetary health, where we can think, where we are forced to think more comprehensively about these complex issues. Number 2 is that public health leaders often focus on short-term victories that mirror political and funding timelines rather than long-term outcomes, right? And that's just the reality of the way we live in. But the funding cycles are often in 2, 4, or 5 years rather than 10 years or 20 years, looking at impact for 10 years or 20 years down the road. Number 3 is that it's difficult to measure the success of pandemic prevention. You are talking here, I am talking here about preventing a pandemic from occurring. So you do not have a counterfactual. And for example, if you're talking about vaccines and administering vaccines, it's a lot easier to point to the data coming out of that effort, right? This public health campaign in such and such area led to the vaccination of 10,000 children in a 2-month period, right? Which is important, and you can measure what is done. Whereas when you talk about saving rainforests to prevent pandemics, it's just harder to wrap our heads around the success of such efforts. And finally, there's a bias for inaction, right? We just tend to wait for tragedy to strike rather than preemptively addressing that problem through prevention. Now, the good news is that I've noticed a change over time. Colleagues that I work with closely, myself, we've been engaged very heavily in advocacy over the last 3 years, and we have noticed a change over time. For example, more recent documents from the World Health Organization Independent Panel and the Biden administration actually acknowledge the importance of addressing spillover. And again, I think that advocacy by civil society and also the work done by academics such as yourselves around the world has had a big impact on shifting this conversation. So let's dive a little bit deeper into what I mean by pandemic prevention. Secondary prevention is pandemic prevention is actually can actually be broken down into two different blocks. Now, the first block that I think we tend to think more about when we are talking about prevention, if we are talking about prevention at all, is secondary prevention. And that is about containing the spread of a pathogen after an outbreak has already occurred to avoid an epidemic or a pandemic, right? So it's preventing the spread, the expansion of an outbreak from becoming something bigger, right? So that's absolutely important. And quite often, even though prevention is not explicitly mentioned in many of the efforts that I've already cited, decision makers are actually implicitly talking about secondary prevention. And that's because many of the actions for secondary prevention and pandemic preparedness are related to each other. Stuff like better surveillance and improved capacity to do contact tracing and better vaccine research and development, right? So those are all tools for secondary pandemic prevention and pandemic preparedness. But what is not discussed explicitly or even implicitly is primary prevention. Primary prevention is about avoiding an outbreak altogether through reducing the risk of pathogen spillovers, as well as improving laboratory safety and addressing biological weapons, right? So primary prevention is about avoiding an outbreak altogether. And based on historical precedent and the ongoing pace of environmental degradation, spillover is the most likely cause of the next pandemic, meaning that reducing risk of spillovers must be a priority for public health, alongside increasing investments in laboratory safety and addressing biological weapons and addressing the risks of synthetic biology. Now, why are secondary prevention and preparedness efforts alone insufficient? Well, there's at least 4 reasons that I list on this slide. Number 1 is the inequitable distribution of the tools of secondary prevention and pandemic preparedness, right? The tools of secondary prevention and pandemic preparedness, such as vaccines and therapeutics, are inequitably distributed. And right now in the world as it is today, and I'm sad to say, I think even despite best efforts to address inequities, I think it is frequently, if not always, going to be the case that someone in a place like New York, where I live, is going to have more access to those tools than someone living in a resource-limited setting outside of the United States. And to me, that is a fundamental injustice. In contrast, when you invest in primary prevention, right, by preventing an outbreak from occurring at all, everyone benefits, particularly people in resource-limited settings. Everyone benefits from upstream prevention. Reason number 2 is that infectious diseases often defy conventional wisdom. Just look at the last decade alone with Ebola, Zika, SARS-CoV-2, Mpox virus, time and time again, these newly emerging viruses, especially when they hit epidemic and pandemic levels, have surprises that defy our conventional wisdom, and that can have tragic consequences for human health. And a future pathogen X out there will also carry surprises that will defy our conventional wisdom. And again, this underscores why it's better to prevent that outbreak in the first place from occurring at all. Reason number 3 is because of spillback. If you just focus on the human side of the equation, you're going to miss the opportunity for spillback, in which zoonotic pathogens that have spilled over into people can jump back into animals. And as they move across these species barriers, these pathogens, they can potentially pick up new mutations and develop new capabilities that increase their virulence and their ability to spread and cause epidemics and pandemics. And again, this has been a major concern for SARS-CoV-2 with deer, for example, and also with Mpox virus, as Mpox virus has been found in now new locations around the world. And finally, we live in an age of disinformation and misinformation, right? Because of the internet and social media. And so just because we have an effective and safe vaccine or therapeutic, there is no guarantee that large enough segments of the population will actually end up using those interventions because of that spread of misinformation. And we saw this with COVID. In many countries with virtually unlimited supplies of COVID vaccine back in 2021 and 2022, those countries could not even get enough of their populations vaccinated to reach target levels because of that misinformation. Just to drive home this point further, let's take a look at mpox. It is hard to imagine a zoonotic virus that the world was more prepared for than mpox. And why is that? Well, we have had decades of experience with mpox virus. It was discovered back in the 70s. People have been fighting, experts and public health workers around the world have been fighting mpox for decades. Sexual transmission for mpox virus has been a suspected mode of transmission for years. Pharmaceutical countermeasures exist, including a vaccine and potential therapeutics. And yet, despite all of this, all of these advantages that we had going into that most recent epidemic of mpox, despite all of that, we found that mpox spread widely throughout the world in 2022, underscoring why concurrent implementation of measures for primary prevention has the potential to promote greater equity. So I want to be clear, it's not an either or. We can't only be talking about primary prevention or secondary prevention. We have to be doing both alongside each other. So how can you implement primary prevention by reducing the risk of spillovers? Well, there's at least 4 interventions that we need to be focusing on, and there are other ones as well. But these 4 include stopping deforestation and forest degradation in heavily forested tropical areas. Number 2 is enhancing the health and economic security of communities living in areas of high deforestation. Number 3 is strictly regulating the wildlife trade and wildlife markets that include species that pose a public health risk. And again, I want to emphasize that when doing those regulations, we have to be sure to secure the rights of indigenous peoples and local communities for them to still be able to access wildlife, right? Both for subsistence reasons and also for cultural reasons and other reasons as well. And number 4 is improving infection control during animal husbandry. But it's important to emphasize again, there is no public health intervention that is perfect. Those of you who are clinicians are probably familiar with the Swiss cheese model. When we do medical procedures, we use a variety of checks and balances to avoid errors from happening, right? There's a checklist that a surgeon might go through before doing an operation to make sure that they are operating on the left leg instead of the right leg, because the actual problem is indeed on the left leg, right? So we use a variety of checks and balances. And we need to be doing the same thing when it comes to pandemics because the stakes are too high. We have lost over 90 million people in the last 105 years from pandemics, and that death toll will only increase in years to come if we don't take comprehensive action. And that's why we had to add layers that include both primary prevention, secondary prevention, pandemic preparedness as well, all together so that we minimize pandemic morbidity and mortality going forward. The costs and benefits for preventing spillover are also clear. A pandemic such as COVID costs trillions of dollars in economic losses and millions of lives. Compare that to investing in upstream prevention, where preventing spillovers only costs around $20 to $30 billion a year, as per this analysis that was published in 2020 in the journal Science. And beyond that, there are other ancillary benefits of preventing spillover, such as mitigating climate change and preventing loss of biodiversity. So I want to take a moment now and tell you a little about an investigation I did when I was at CDC, just to drive home the point about reducing risk of spillover and understanding that there are communities at higher risk that need to be the focus of our attention for equity reasons. So let's talk for a moment about bats, all right? I want to be very clear. I love bats. They're my second favorite group of animals after snakes. It's important to acknowledge that bats provide major ecological services that we depend upon as humans. Pollination, for example, of plants, including farm crops. And number 2 is that bats are important, important for pest control. Many different species of bats eat a large number of insects in a given night, and we benefit from that pest control. But at the same time, a number of bat species have been implicated as reservoirs for a variety of deadly viruses, including lyssaviruses and filoviruses, henipaviruses, and others, right? And there's a variety of reasons that might contribute to why a bat is able to harbor this range of viruses, including different function, different immune function than in humans, and also their ability to fly over large distances, which might contribute to their distance, their ability to take pathogens from one location to another location, just like in humans, right, where we have air travel that facilitates the spread of pathogens. Now, for this investigation that I'm about to describe, I also want to be very mindful that I'm not trying to sensationalize any particular cultural practice, and we have to be very respectful when talking about cultural practices that are done in other parts of the world that we might not live in or be a part of. There are things that we do here in the United States that also might seem foreign to people in other parts of the world, and so we just have to have a respect when looking at other cultural practices from different parts of the world. But back in 2013, some colleagues and I at the CDC had heard through contacts and colleagues in Nigeria about an annual bat festival that takes place in a rural part of Nigeria. And in this festival, there are two caves where people, and it's only men and boys, are allowed to enter these caves during this time of the year where there is this bat festival. And the local king announces, along with his priest, that now is the time of the year for the bat festival. People are not allowed to enter those caves outside of the bat festival. And so during the festival, which lasts anywhere from a few days to almost a week, these men and boys run into the cave and catch all the bats that they can. They're swinging tree branches, knocking down bats, catching them with their bare hand. And you see in this picture right here an example of one of the bat hunters holding a bat that he had caught in the course of this festival. I want to note that the bat that he is holding is a Rosetus aegypticus bat, which is a known reservoir for Marburg virus in Central Africa. Marburg virus is a relative of Ebola virus that carries a very high mortality rate when outbreaks happen in humans. Sometimes as much as 50%, even more, of people will die in an outbreak from Marburg virus. Here's another picture of bat hunters. You can see the slingshots around their neck. Again, they're holding bats with their bare hands. And here's a pile of dead Rosetus aegypticus bats that were caught in the course of this festival. Our concern about hearing about this festival is that these are people interacting with bats without personal protective equipment. These bats could be harboring deadly viruses. This could cause an outbreak. And then again, even though this was a relatively rural area of Nigeria, it is interconnected to other major cities in Nigeria, including Abuja and Lagos, which are major cities in Nigeria. And so, again, the concern here was, what is the risk to people, and do these bats actually carry pathogens? And so we went to this part of Nigeria to do an investigation to understand the viruses that are in these bats and the risk that people are under. Now, because of government approvals, it takes a long time in the US government to get approvals to travel, especially to areas of the world that might have insecurity, and this is one of those areas. Everywhere we travel was with bulletproof vehicles, with armed guards, with AK-47s. So because of those government approvals, we missed the timing of the festival by 1 week. We ended up showing up a week later. So we had to get, of course, permission from the local king to enter the bat cave so that we could collect samples from these bats. And I want to be very clear, I know that there's a lot of different opinions on the utility of testing wildlife for viruses. But to be very clear, this is a part of the world where people are already directly interacting with these bats, at least on a yearly basis, if not more frequently than that, right? People are catching bats and interacting with them. And so we got the king's permission to indeed go into these caves, but we were fully suited up in personal protective equipment, taking precautions to avoid any type of exposures. Biosecurity is an absolute must when engaging in this type of work. And so we got the permission, and here we are trekking through the forest to get to the cave. And you can see in the foreground my colleague, Mike, and in the background is the bat cave. And so there's these massive boulders, and you're fully suited up, and you ascend the boulders, and then you descend down into the cave. And once you're in there, it's pitch black except for where your light is, your headlamp is flashing. The floor is literally moving because there's frogs and lizards and a variety of insects. I love this type of environment. I know it's not for everyone. Bats are flying everywhere. And of course, we set up nets to catch some of these bats, and then we collected samples from these bats. And in the course of this work, we indeed detected that these bats had antibody serologic evidence of exposure to Lissa viruses. So rabies virus is probably the deadliest virus in the world. Once you show symptoms of rabies, you are sadly virtually guaranteed to die. And there are other related viruses to the rabies virus that for which the rabies vaccines might not work. And so we found evidence in these bats that there are rabies-like viruses that are probably circulating in these bats. And we also discovered a new species of bacteria, a Bartonella genus bacteria, that we confirmed also had infected people as well in this area. And here we are doing surveys in local communities surrounding the caves and inquiring about the participation levels in this festival and whether people had exposures to bats, what type of health precautions they take. And here's the results of this work, right? So like I said before, we discovered a new bat-borne bacteria capable of infecting humans and evidence of lyssavirus circulation among bats. And we had over 2,000 people represented in our community surveys. We found that 10% of them had reported ever having had bat contact, including 2% that had ever been bitten by a bat. These are astronomically high levels, right? I don't know anyone in my life right now that has ever had bat contact, except for a small number of people who are scientists, basically. And I definitely don't know anyone who has regularly been bitten by bats, right? But these are people who are facing those exposures. And so of those people with bat contact, only 1% had ever received rabies vaccination. And here is the inequity, right? This is an area of the world where people are interacting with bats, having these exposures, whether intentionally or not, and yet there's very little access to rabies vaccination. And this is an area at high risk for an outbreak, and there's massive inequity in access to necessary health precautions. Now, you might remember back in 2013, there was also the start of an Ebola outbreak in Guinea, Liberia, and Sierra Leone, right? And so the source of that Ebola outbreak probably ultimately came from bats. Yet people, such as in settings like this, probably do not have access to Ebola vaccination, even though they might be at high risk. And this is the type of health inequity that we need to be addressing, and we need to be focusing on an area like this as a place to prevent spillovers. The goal here is not to tell people what to do with their lives or how to live their lives. It's just to give people the tools so that they can stay safe. I'll also add, just to emphasize, that whenever doing research like this, we always do it in close collaboration with local partners. So we had teamed up with the Nigerian Ministry of Health and the local health department and also local universities in doing this type of work, right? Because you cannot, as an outsider, just come into an area and do research and then just leave the area and take the data, right? You have to do everything in combination with local partners to make sure that we are helping to build capacity in these areas that might have less capacity. I want to shift the topic of the conversation a little bit before we move into the Q&A and just acknowledge that we are now experiencing a syndemic with common etiologies. Pandemics, climate change, and biodiversity loss are three existential threats that are all on the same side of the same coin, right? They're rooted in human activities that are leading to massive extraction of resources and ultimately the destruction of nature. And the climate, this is without a doubt, climate is changing because of human activities, particularly the burning of fossil fuels. The evidence for this is unequivocal. The effects are already being experienced. This is not some future threat, right? We are experiencing the health impact of climate change right now, today, and it'll only get worse in the coming decades unless we take action. And there's a wide range of health effects of climate change, everything from worsening chronic diseases to worsening infectious diseases to malnutrition to migration. This is an issue regardless of political spectrum, right? Whatever side of the aisle you're on, we can all agree that we want better health. And I think we can all agree that the climate is changing, right? We know that we can experience that in our daily lives. Just talk to people who've lived in an area for 30, 40 plus years. They will acknowledge that the world is different today than it was a few decades ago. And it behooves us to take action now, right? What are the, beyond stabilizing climate, but through many of the interventions that we need to address climate change, we will also get cleaner air, cleaner water, right? There are multiple benefits from investing upstream in addressing climate change. And, the focus of my talk today has been particularly on zoonotic diseases, right? Viruses that jump from animals into people, sometimes bacteria that jump from animals to people. But there are a number of other infectious disease groups whose transmission will likely be made worse by climate change. Vector-borne diseases, such as those transmitted by mosquitoes, foodborne diseases, waterborne diseases, fungal diseases, ancient pathogens. And those last two categories in particular worry me, particularly fungal pathogens. You know, we have seen entire extinction of species. Over 50 species of amphibians have gone extinct because of a fungal disease called chytridiomycosis. And right now, across the United States and Canada, millions of bats are dying because of another fungal disease called white nose syndrome. Right? Just look at the devastation that some fungal diseases can cause. And we know as I'm a medical doctor, and you know, I've treated patients with fungal disease. Fungal diseases can be exceedingly difficult to treat because fungal cells are so similar to human cells, right? So our medicines to treat fungal diseases often carry very massive side effects in humans. But there is growing concerns that climate change will actually be changing the ability of the temperatures at which many fungi can live. Right now, there's a thermal barrier that blocks many fungi from thriving at a higher temperature because many fungi just naturally do better at a lower temperature than the human body temperature. But as the climate changes, these fungi are evolving to live at higher temperatures, right? And that might mean that we will experience more and more fungal disease outbreaks of novel fungal pathogens in years to come. And one very devastating fungal pathogen, a species of Canada that has been spreading in hospital settings around the world that sometimes kills as many as 50% of people that it infects. One theory for how that new fungal species has evolved is because of climate change. And so this is just a massive concern to me that we are not talking enough about fungal diseases, including myself, right? Today, I focus mostly on viruses, but fungal diseases is definitely an area that needs more attention. And then the reason I say ancient pathogens is that in areas of the world that are currently under ice, under permafrost, that are going to be thawing as the climate warms up, we might see that ancient pathogens that have been frozen for many years might actually be able to revive and go on to infect people. The reality, though, again, is that we need to limit temperatures to 1.5 to 2 degrees of warming beyond pre-industrial levels. The chances of doing that, of limiting warming to just 1.5 degrees Celsius is very low. Let's strive for 2 degrees Celsius beyond that, right? Every 1/10 of a degree more of warming that we have globally will have massive, massive impacts. And, you know, I'm not going to, just in the interest of time, I have some excerpts from David Wallace Wells, who wrote this incredible book, Uninhabitable Earth. I'm not going to read these, but I think it's worth reading that book if this is a topic of interest for you. And I don't, but I do want to just emphasize the quote that you see here that was included in that book, The Uninhabitable Earth. The foreign minister of the Marshall Islands offered another name for 2 degrees of warming: genocide. And I don't say that lightly because, you know, genocide is a term that carries a lot of weight. But we are seeing entire nation states that might cease to exist because of a changing climate. And that is an injustice, and it's inequitable. And again, regardless of political spectrum, you know, whatever side of the aisle you're on, I think we can all agree that this is a problem because even from a self-interested perspective, right, we want to, for example, some people's political views are that we have to make sure that migration is limited to certain categories of people or whatever else into the United States. Well, we are going to be seeing more and more migration into the United States because of climate change. There already are, and there's going to be more and more climate refugees around the world. I'm going to skip this slide in the interest of time. I'll just emphasize that even though we've had major agreements in recent years to limit climate change, the current national plans that align with this major Paris Agreement, sadly, would only lead to an increase. The current commitments that countries have made would only lead to an increase in global greenhouse gas emissions by 2030 compared to 2010 levels. We are seeing that fossil fuel subsidies are only increasing. The prior major climate change conference that happened in the United Arab Emirates just a few months ago, which is the major global conference to put us on the path to addressing climate change, the president of that climate change conference was the former president of the national petroleum company for the United Arab Emirates, right? There are all these conflicts of interest, and we are not taking enough action to address climate change. And here's just more quotes from that book. But I want to emphasize the climate equity aspect here. The people least responsible for climate change tend to be the ones who are most susceptible to it. For example, the 100 least emitting countries generate 3% of total emissions, whereas the 10 countries with the largest greenhouse gas emissions contribute 68%. And these 10 countries have more resources to deal with climate change than these other 100 least emitting countries. The people that are most affected by climate change with the least ability to adapt are women, children, people of color, indigenous people, socioeconomically marginalized people, people not yet born today. And the Lancet has even called climate change, the Lancet being one of the world's leading medical journals, the greatest threat to human health we face this century. There's another existential threat that we face today, which is the loss of biodiversity. We are in the midst of the 6th mass extinction. And there have been 5 prior mass extinctions up until now. 4 of those were the result of a changing climate produced by greenhouse gas emissions, different from the climate change that we're experiencing right now. One of those mass extinctions was from an asteroid, but the current mass extinction right now is because of human activities, particularly land use change and climate change. And there are so many health benefits for biodiversity. Biodiversity, again, refers to the variety of life on Earth, but we rely on nature and biodiversity for our very existence. We cannot live without nature. Biodiversity is everything and everywhere, and we need it for clean water, for food, for our mental health, for new access to medicines, to prevent infectious disease emergence. We need biodiversity, yet we are decimating it around the world. And if we don't preserve biodiversity, we are only killing ourselves. And some of you might already have children or planning to have children. We are leaving future generations with fewer forms of life than we have today, which is less than what we had 10 years ago and 50 years ago and 100 years ago, right? And this is going to have tragic consequences, and it's already having tragic consequences for human health. I've made this point. I mean, loss of biodiversity increases risk of infectious diseases, again, which is the focus of my talk today, right? We talked about how deforestation leads to infectious disease emergence, but also the drug pipeline. Between 1981 and 2010, 75% of antibacterials newly approved by the US FDA could be traced back to products of natural origins. We are decimating a natural medicine chest that exists out there. So just to wrap things up, we are in the midst of a new geological epoch called the Anthropocene, where humans are the dominant force shaping the planet's biophysical conditions, and our impacts on the planet are only exponentially intensifying. And there's a paradox, because for decades now, hundreds of years, our extraction of resources around the world have led to massive benefits for access to energy and longer lifespans and reduced childhood mortality. Those are all great things, but we're at a tipping point now, an inflection point, because we are now seeing those benefits beginning to slow down and even reverse. And as one person has said before, we have been mortgaging the health of future generations to realize economic and development gains in the present. There's a huge range of health implications for what we are doing to the planet that we've talked about, but we must, going forward, break down silos. We have never lived in a world, as my colleague Jonathan Jennings says, we have never lived in a world where the health of people, animals, and ecosystems could be addressed in silos. But this is how our health institutions are designed. So in fact, our health institutions that are focused just on a single species, Homo sapiens, are inherently flawed. We are facing existential threats from climate change, biodiversity loss, and pandemics. And no single institution, discipline, or individual can solve these existential threats on their own. We need to work together. We have to be breaking down those disciplines, those artificial silos that keep us separated. We are trained to think reductively in academic settings and even in the real world, where we are told to focus on single problems, but singular reductive thinking is what got us in this mess in the first place. And that same thinking, therefore, cannot get us out of this mess. So is the global environment in a bad place? Yes, but I want to emphasize we have not lost yet. We have not lost yet. We must reject the delusion that it is too late to act. What happens from here is our choice. And I've personally never been more optimistic for the future than I am today. Action is the antidote to despair. If you are feeling that eco-anxiety, if you're worried about the world, take action. I know many of you are already doing that, but that is where we start seeing that there are so many possibilities and there's so many ways for us to do better. And we can make the impossible possible in the years and decades to come. I'd also emphasize, we don't need to be perfect. We don't need 100 activists. We need 1 million imperfect ones. None of us are perfect, right? Just take action where we can. I love this quote. Again, I'm not going to be able to read it, but this is from Jamie Reeser, a colleague at the Smithsonian. I definitely recommend that you read some of her work. I think there's a lot that you all can do as health professionals, and I'm defining this very broadly because I know there's a range of different people on this call. It starts with being bold in our vision for what it means to have a healthy future. We need to employ a One Health and an equity-focused lens in the work we do. We have to support future generations of interdisciplinary researchers, build partnerships, broaden how we tackle these problems. We have to advocate and change policy. I know that often scientists can be hesitant. There are concerns about being impartial, but we cannot divorce our knowledge from value. We have to use the knowledge we have to effect positive change. Otherwise, it is a dereliction of duty. We need to make healthcare delivery and research sustainable. We need to stay informed and counter the rampant spread of misinformation, join coalitions of people who think differently than you. Tell stories and communicate effectively. Educate communities about reducing meat consumption and non-motorized modes of transport. That is good for their own health and also good for the environment. There's a lot of different ways to get involved depending on your professional background. I urge you all to read this editorial that was published in the New England Journal of Medicine just a few years ago. I leave you with this thought that conservation is public health. Everything we do to save nature is saving ourselves. If you are a trainee, for me, when I was like a teenager, I saw the movie Outbreak, and I knew that I wanted to wear a spacesuit and chase dangerous diseases. And then I watched Contagion like at 12:01 a.m. the night, the day it came out. Kate Winslet in that movie was an epidemic intelligence service officer. And so if you're thinking, if applied public health is of interest to you, think about the Epidemic Intelligence Service program at the CDC. I did it. It was an incredible training opportunity. And so learn more about it at that website. Remember, your dreams are possible. You can chase those dreams and you can make them a reality. As you are figuring that out, ask yourself these questions. What brings me joy? What am I good at? And what does my community need from me? And try to be in the middle at the intersection of the answers to those three questions. And I think that's where you will find a lot of fulfillment in your own career and a lot of happiness. I know I'm over time, so let's just stop sharing here, and I'd love to take any questions.
Dr. Vora, thank you for such an amazing, wonderful, and inspiring talk. I both for the content and for the sentiment. Hallelujah, brother. Do we have any questions for Neil after that wonderful talk?
Everyone should be able to unmute yourself now if you want to ask in person or put a question in the chat as well.
Oh, also, I see Dr. Miller has been able to join us. Deb, do you want to say hi just as a lead-in?
I do. We do have a question. I can stay on after to say hi and but I will say this. I just got done teaching to my class, and everybody, I always say, if I could just get people to understand how important biodiversity is to health, I would be so happy. So thank you. But I think Lindsay has a question.
Thanks, Dr. Miller. Yep. Hi, Lindsay.
Hi, thank you so much for such a great presentation. Covered all the important points and it was very powerful. I just had a question about the whole primary prevention and secondary prevention debate. In some policy literature I've read and in different policy discussions, people are always quick to say that it's difficult to prove a negative when you're trying to justify spending money on primary pandemic prevention. And I was just wondering if you've ever been in that experience, advocating with a policymaker, and how you approach that question. Does it come down to showing comparative cost benefit analyses, or just showing data from past pandemics and saying, look, this is what could be avoided? I'm just interested in what your take is on that to kind of handle those types of questions.
Thanks, Lindsay. And I think that's the challenge in public health, right? We are a victim of our own success as you do a better and better job with public health, whether it's with vaccination or water sanitation or whatever else. People forget that public health is running in the background, but that is a public utility that here in the United States, we benefit from, depending on the part of the country that you're in, but many parts of the country have strong public health systems, and then at least at lower and lower investments over time, right? Because there's also a need to have, or some people feel very strongly about fiscal austerity, et cetera. And so there's these cycles of panic and neglect. And I think, again, particularly when it comes to prevention, when you're successful, you don't experience that bad outcome. And so it's hard to point to the benefits of investing in prevention. And I don't think there's a magic bullet, right? That's the challenge that I continue to be up against, that it's a lot easier to wait for tragedy to strike and then say, you know what, let's put a Band-Aid on it. Let's, let's vaccinate people and do contact tracing, which is all important. And that's the world that I lived in. I when I was with CDC, and it's so important, but then it's just easier to neglect upstream prevention and trying to avoid the problem in the first place. But relatedly, I think there's also a challenge of familiarity, right? In a lot of these circles where we're talking about pandemic preparedness and pandemic prevention, there's always talk about investing in surveillance. And surveillance is the backbone of public health. We need surveillance to do good public health. There's no doubt about that. But the dominant discussion in these conversations that I'm a part of about pandemic prevention and preparedness is about investing more in surveillance and modernizing surveillance, which we need to do. But as my colleague Reina Plowright has suggested before, I don't think there's any evidence that more surveillance in the world would lead to us preventing a future pandemic from a novel virus that is capable of transmitting between people before people show onset of symptoms, just like SARS-CoV-2, right? Even if you have all the surveillance in the world in a place like New York City, you're not going to be able to detect a virus fast enough, a novel virus fast enough, if a person is infected with that virus and is spreading it in Times Square before they even show any symptoms. And so I think the reason why we are emphasizing that solution, though, is because the decision makers of the world are familiar with that intervention, because the decision makers in the public health world tend to be ones who are trained in biomedical expertise, and they do not have training in ecology and climate change and biodiversity, right? And so we are biased towards what we're familiar with, even though there might not be as much evidence for some of these interventions that we are pushing so hard. So I didn't exactly answer your question because it's a hard question to answer. I don't have a good solution for you. And I think that's the work of telling stories and continuing to collect data and doing important research. And again, remembering that we need a balanced approach when addressing a threat as big as pandemics.
Oh, thanks so much for your insight on that.
So I know we're coming to the end of the hour, and many of us, myself unfortunately included, need to go to next meetings, but hopefully this conversation can continue, and anyone who can stay on the call, I would encourage you, and Neil, with your permission, I'm going to shamelessly stalk you afterwards by email and hopefully connect on many other things. So let's please all, before those of us who do have conflicts have to go, let's please all give Dr. Vora another round of applause for an amazing talk. Thank you so much. And join us next month for our next Lunch and Learn and many more things with our One Health initiative. Thank you.
Thank you all so much. It's a pleasure to be here. And please feel free to email me. I just want to be very clear. I'm not criticizing surveillance. We need to be doing surveillance. It's absolutely important. I'm talking about having a balanced approach in our approach to pandemics. Thank you all so much.